This video gives an overview of the background of transition of care codes and the guidelines on how to use them. Pediatric practices should provide follow-up care to patients with conditions that require moderate or high medical decision-making within 7 or 14 days of discharge from an inpatient hospital or other facility. From a payer's perspective, it's important for patients with these conditions to transition back to the home and minimize readmission. This is done by the extra care that is provided through a PCP within the 7 to 14 day window. For this reason, payers will reimburse for transitional care management coding at a higher rate than an E&M code. The appropriate codes for transitional care management include 99495, which is a moderate level medical decision-making condition, and the patient was seen within 14 days of discharge from a hospital or other facility. 99496 involves a patient with a high-level medical decision-making condition who was seen within 7 days of discharge from the hospital or other facility. For either code, the patient should receive an initial follow-up contact within 2 business days and then be seen in the office within the time frame as described. Please note that the 2 transition of care CPT codes are only used for patients that were admitted, not as a follow-up to an ER or urgent care visit. The code 99495 or 99496 should be used for the first office visit after discharge from the facility and the level of medical decision-making. Additional office visits should be based on the provider selecting the appropriate E&M code based on either medical decision-making or time. An E&M code should not be added to a visit with either a 99495 or 99496. In this example, the practice learns that a 4-year-old patient is hospitalized due to a severe asthma attack. The practice receives real-time information on the hospitalization via the Integrated Healthcare Exchange connection. A provider reviews the background health data shared by the HealthShare Exchange and requests the medical assistant to contact the parent of the child. Within 2 business days of discharge, the practice contacts the parent, obtains some background information on the hospitalization, and schedules a follow-up visit within 7 days of discharge from the hospital. The provider sees the patient and identifies that the asthma was severe, and the child also has a history of severe allergic reactions that require the parent to carry an EpiPen. The provider determines that the condition is high medical decision-making. An example of the coding for the visit is as follows.